Dr. Baliga here. I have another terrific podcast for you, the Must Know EKG podcast. You'll find this podcast educational, like all other podcasts in this Must Know EKG series. This podcast is derived from EKGs available at mastermedfacts.com. A 51-year-old banker has a routine EKG as a part of his annual examination. The EKG is as below. This EKG shows 1. Mobitz type 2 heart block, 2. Hayes heart block, 3. Complete heart block, 4. Mobitz type 1 heart block, and 5. Complete heart block. Press pause while looking at this EKG. And the answer choice is choice 4, Mobitz type 1 heart block. Type 1 or Wenckebach AV block is owing to depressed AV nodal conduction and is recognized by a prolonging PR interval ending in a drop beat. Type 1 Mobitz or Mobitz 1 is characterized by group beating with progressive shortening of the PP interval, constant PR interval, PP pause duration less than twice the normal PP interval. This EKG is another example of second-degree AV block Mobitz type 1 or Wenckebach. This patient also has a left anterior fascicular block. So Mobitz 1, second-degree heart block with progressive lengthening of the PR interval and eventual failure of the P wave to generate QRS complex. Mobitz type 2 or Hayes block, there is failure to produce a QRS complex on every second P wave. And complete AV block, P waves bear no relationship to the QRS complexes, which are regular and wide. This is another example of classic Wenckebach. The EKG is courtesy of Dr. Brad Knight, MD, the Chester C. and Deborah M. Cooley, Distinguished Professor of Cardiology at Northwestern University in Chicago. And here you'll see the PR interval prolonging till there's a drop beat. Historical perspective. Wenckebach was a Dutch anatomy professor who was a native of Hague. He studied medicine in Utrecht and became professor of medicine at the University of Groningen. Later, he was professor at the Universities of Strasbourg and Vienna. Mobitz was a Russian physician in Germany. He was born in St. Petersburg, Russia. He analyzed arrhythmias by graphing the relationship of changing atrial rates and premature beats to AV conduction. Through an astute mathematical approach, he was able to classify second-degree AV block into two types, subsequently referred to as Mobitz type 1 or Wenckebach and Mobitz type 2 or Hay. John Hay was a Scottish physician who practiced in Liverpool, England, and was a discoverer of type 2 AV block. Mobitz type 1 is also known as Wenckebach or second-degree heart block type 1. All three names refer to the same EKG rhythm and can be used interchangeably. So first-degree heart atrioventricular block is a prolongation of the PR interval greater than 0.2 seconds. Every P wave is followed by a QRS complex. Second-degree heart blocks are three types, Mobitz type 1 or Wenckebach. In Mobitz type 1, there's progressive lengthening of PR interval and shortening of the RR interval until the P wave is blocked. The PR interval after the block beat is shorter than the preceding PR interval. The second EKG strip shows Mobitz type 1. The third EKG strip shows Mobitz type 2. That's intermittently blocked P waves. The PR interval on the conducted beat is constant. The third type of atrioventricular block, second degree high grade atrioventricular block, is where the conduction ratio of P waves is 3:1 or more. The PR interval of the conducted beat is constant. In this rhythm strip, which is the fourth strip from top, there are 3 P waves, one of which is buried in the T wave, in the preceding T wave. And the last strip, or the bottommost strip, is the third degree AV block. There's dissociation of atrial and ventricular activity. The atrial rate is faster than the ventricular rate, which is of junctional or ventricular origin. This concludes this Must Know EKG podcast. Follow me on Twitter at RRBaliga MD.